Bismillah, walhamdulillah, wassalatu wassalamu ala rasulullah wa ba'd. In this short video, I want to talk about an update to JET version 3, the JET Hijama treatment version 3. Now, how this update came about, basically, I was recently talking to one of my students, one of my advanced students, and what happened during that conversation, he actually told me how he basically defines static jinn or a static spiritual disease in the body. So he had a different definition from mine, and what you could call his definition is that it's basically a semi-static. You could call it semi-static. Now, my definition of a static jinn in the body would be stationary and not moving anywhere, and that's how that definition is what I used for locating the jinn in my body. So when I did Jet version 3 on myself, when I asked Allah subhanahu wa ta'ala to show me if I had a jinn in this particular area of my chest, my definition of if the jinn was stationary or static is that it's not moving 100%, it's in that area, it's not moving anywhere else, and it's not being anywhere else, it's just there basically. It's just sitting there waiting for me to take it out. So I'm pretty defined in pretty specific in my definition of what I see as static. Now his definition is a little bit different. Now he basically said that no, Asad, I don't do it like that. Because the conversations came up, so I was wondering why people trying what I did. How come it's not working for other people? And it worked quite well for me, but it's not working for other people. And it seems that what is happening is that people are maybe defining static exactly how I defined it, very specific, like 100% the jinn is not moving, and they're looking for that. And sometimes you're not going to get that kind of reaction for a static jinn. Maybe the jinn is moving slightly. So if the jinn is moving slightly, so let's just say the jinn is in the chest area, in the particular area in the chest, and it's moving slightly in that area. Now, if with my definition of it, you're not going to get any reaction for that, because that jinn is slightly moving in that chest area. However, for my student's definition of static, let's call it semi-static, he would get a reaction. So then what he would say is that, look, the jinn was basically moving, but it's not moving in the large area. It's in the small little area, but it's basically static. Let's say semi-static. It's not going too far to other places of the body. It's stationary in one particular place, but it's not as one. Let's not say it's 100% stationary, but it's in an area, in a particularly defined area. It's not over here. It's not over there. It's in the chest area. It's moving. It's moving slightly. But it's not 100% stationary. And I sat down and I thought, well, you know what, maybe that's what's causing the problem for other people. That's why not many people have come back to me regarding that Jet version 3, which I describe in How Allah Killed Me my video, How Allah Killed Me, and my article, How Allah Killed Me. Not many people have come back to me and said they've actually did what I did. Some people have, but it's not many. I'm still surprised that not many people came back. And I think maybe this is the reason why that is, because I'm very specific in what I said. Stationary jinn, not moving, and maybe people are not suffering from that type of jinn yet. Or some people are, but most people are not having the type of jinn which I had, which was stationary 100%, not moving and just staying in one particular area. Maybe most of the other people maybe are having jinn which are in a defined area, but they're slightly moving. They're slightly moving. And what my student said is that he himself treated himself like that with jinn and sihr and the other spiritual diseases, and he also is treated other patients with that sort of definition of semi-static spiritual disease, and it's worked for him. So what I would advise patients to do is to not define, if they don't get any reactions for my definition of static jinn, which is 100% not moving, not stationary, not doing anything, just staying in one particular place. If you don't get any reaction for that, then try the semi-static definition of a jinn, which is, you know, moving slightly. You know, yes, it's in a defined area, it's in a specific area still, but it's not. It's just moving slightly. You know, he said it's been quite successful for him with treating himself and treating his patients. So if other people try this out, you might find, inshallah ta'ala, hopefully we'll find this particular update or change to the Jet version 3. Inshallah ta'ala, I pray Allah makes this successful.